Morning, wake up back your way. Appreciate you joining us today. We've been talking so much here about veterans' issues, and I don't think we can do it enough, especially with the drilling down a bit, if you will, on those who suffer from post-traumatic stress and what that can manifest itself with. Heard from the congressman talking about misconduct and discharges, then the inability to get benefits through the VA, and this is like it's like a nasty cycle, a never-ending cycle that for these veterans spirals and gets worse and worse and worse. Now, news that more than 3/4 of our wounded veterans deal with some form of post-traumatic stress disorder. This is according to the Wounded Warrior Project. More than 23,000 injured service members completed their survey in 2015. The results just out. In the 15 years since combat operations began in Iraq and Afghanistan, 2001, right after 9/11, more than 52,000 men and women have been physically wounded. And it's estimated now that at least 400,000 members of the Wounded Warrior Project are dealing with PTSD, another 320,000 suffering from traumatic brain injury, TBI. Someone who treats these veterans is Dr. Al Johnson, joins us now. Good morning, sir.
Good morning.
Do these numbers surprise you in any way, shape, or form, or does it surprise you that it's taken us this long to come to grips with it? Which one?
Well, no, it's not surprising. War is brutal. What you experience is beyond what we would normally expect in daily life, and it makes an impression on us, whether it affects our brains, as in post-traumatic stress disease, or where we get traumatic brain injury from a bomb explosion or an accident while serving. All those affect the brain and cause different problems in different vets.
Those who would do pushback on this, if there are any at all, say, the cost of dealing with this is going to be immeasurable. But I guess the answer to that is then don't go to war. Because that's part of the promise we make to our servicemen and women, isn't it, that we will take care of them after they come home?
Yes. And they're studying the problem. The government spends $50 million a year in studies to figure out what to do. Arnold Fisher out of New York, a wealthy individual, has put in $65 million in a project in the building to treat vets, and even with that amount of money spent, they treat only 250 vets a year at the present time.
That's that clearly wouldn't even put a dent in this.
Exactly, and that was in the Wall Street Journal this last weekend. So I'm involved with a hyperbaric study trying to treat 1,000 vets with 80 hours of hyperbaric, and the pilot study shows that about 80% are able to get back to functional use with 80 hours of hyperbaric. And hyperbaric actually increases the oxygen to the brain cells and all the body tissues 10 to 15 times, and it rehabs those cells so that they can recover, the ones that aren't dead. Mm-hmm. Recovery varies in individuals, but once the cells are working better, then all these other treatments work better. So the Hyperbaric Medical Foundation is the nonprofit organization that is trying to get this funded and put in place.
Hyperbaric chambers have been around for a while in their various uses, but Dr. Johnson, is that fairly experimental therapy here, or is it something that's widely accepted now?
Well, it's widely accepted for 14 indications, mainly diabetic wounds.
Okay.
And so it's not one of the FDA-approved indications, but there's quite a few studies from overseas with hyperbaric chambers on a variety of problems like stroke, autism, cerebral palsy, traumatic brain injury, exactly what we're talking about today.
And so is this something you see as that you're working with now that could be very promising in a much more widespread way, or would that be difficult to do?
Oh, no, it could be very promising. The Army owns lots of hyperbaric chambers around the country, and they treat like burns and wounds and that type of thing with it. There's just controversy about using it with traumatic brain injury, and so that's kind of held it up. We tried to get congressional funding for the last 3 years, and it's not passed. So now we're having to go to the private sector to try to get funding to help the vets.
So there it is. It's not so much the will, but the way, and the way adds up to dollars, and thereby hangs a tail. So, in your mind going forward, are veterans being treated? And you're there at the front end. You're a frontline person with medical treatment. Are veterans being treated fairly in this country? Are those who are getting care getting good care, or are we falling woefully behind?
Well, we're falling behind, and the deal with the VA and all the problems that people have had getting treatment there is kind of the tip of the iceberg, because those are older individuals. Then we have the ones with the post-traumatic stress and the PTSD, as we're talking about, and they're getting medications. The cost of medication is about $32,000 a year, where the cost for hyperbaric treatment is $17,000 for the 80 hours, and that's a one-time treatment, where the other is just covering up symptoms. So we need a little different mindset on how we're approaching this, to look at just not using medications to cover up symptoms, but really finding out how to repair the brain and then help these individuals recover.
They need you testifying in front of Congress.
I know, we have.
They need to, if this is seriously working, and it seems like reasonable money up front that will not only improve lives but save money down the road, instead of just putting a Band-Aid on it. This actually it seems like what you're doing has a real effect that could lessen costs down the road.
Oh, exactly. And so the Hyperbaric Medical Foundation really needs funding, and you go to hyperbaricmedicalfoundation.org to see how to donate. And it's $17,000 per vet. We're trying to get 1,000 vets in this study, so that it's significant that we can prove with beyond a reasonable doubt that, hey, this works. It needs to be instituted in a treatment program.
It's fascinating. I wish you good luck with this. I want to keep track of what happens with it as well. Dr. Al Johnson, treating veterans with PTSD and using hyperbaric therapy off the top end, 80 hours of it that can greatly decrease the need for the various drugs and all the other medical regimen on the back end. With so many being diagnosed with PTSD and with traumatic brain injury, TBI, this could be very critical indeed. Dr. Al, thanks for joining us this morning. Good luck.
Oh, my pleasure. Thank you.
Thank you, sir. More ahead. This is the Morning Wake Up, and that is very interesting and promising news indeed. More ahead. Morning Wake Up, 1320 WILS.